The benefit, I was saying, of having this kind of a job is the fact that we have the time to actually sit with families and patients, and we can discuss not just the medical problems that they're dealing with, but we oftentimes can get into some of the social dynamics and family dynamics. And there are opportunities in hospice and palliative medicine to create perhaps a greater understanding of the process of end-of-life care and the spiritual components and the social components to this. So the advantage we have in this job, that I have in this job, is I have the time to actually sit and talk to people, and we develop rather intense relationships over a very short period of time. But I think that we're able to help people in more than just the medical sphere.
I pride myself on the philosophy of person-centered care, and by that I mean, as a patient, you really are the captain of your own ship. One of the things that I'm very proud of in medicine, and I've noticed this huge paradigm and culture shift over the last 10 to 20 years, is that medicine has really gone away from the times in which doctors felt entitled to really direct what an individual's end-of-life journey looks like. And I strongly believe that it's up to each individual patient to really paint that picture and decide alone how they will spend their final days. But that begins by having a place of understanding of what has meaning for our patients and families, what they understand to be their current condition, and that you're really there to help facilitate and make that dream happen for them.
I have patients in my clinic with advanced disease that are going to live for months and months, and I have patients under my care that are going to live hours. My job is not to worry about how much time they have left. My job is to make what time they have left meaningful. And so I use the skills and tools that I have in my toolbox to help people to have less pain. I'm a pain management physician, so I gotta attend to that. And a reduction in other symptoms that they might have, shortness of breath, altered mental status, whatever they're complaining of. There's a lot of anxiety and emotional, psychiatric derangements in patients who have advanced disease. What can we do about those things? But ultimately, it boils down to, what does a patient want? And most people want to be as functional as possible and as symptom-free as possible. I do everything that I can to achieve that.